Did you know that more than 25 million Americans report some type of urinary incontinence? Urinary incontinence means a lack of bladder control. It's a very common thing that happens as you age. It can be caused by urinary tract infections, problems with bladder muscles, or it can even be a side effect of some medications. If you do have urinary incontinence, there are ways to improve bladder control. Although it may seem embarrassing to talk about, it's important that you have a conversation with your doctor about any urinary incontinence or bladder control issues you may be having. Your doctor can offer ways to treat it based on your needs. This may include medications, special products, or surgery. But there are also things you can do at home. Use the bathroom often and when needed. Try to urinate every 3 to 4 hours. Holding urine in your bladder may weaken the bladder muscle and make an infection more likely. Try to stay relaxed while urinating. By keeping the muscles relaxed around the bladder, it will make urinating easier. And make sure to take the time to completely empty your bladder. Rushing to urinate may not allow the bladder to completely empty. And if the urine stays in the bladder for too long, it can lead to an infection. Women should wipe from front to back after urinating, especially after a bowel movement. This will help keep any bacteria from your gut from spreading. Wear loose cotton underclothing to keep yourself dry. Tight-fitting pants and nylon underwear trap moisture and promote bacteria growth. Make sure you're getting regular exercise and making healthy food choices. This helps to prevent the bladder issues and constipation, while also helping you maintain a healthy weight. You should talk to your doctor about what type of exercises are best for you. Be sure to drink plenty of fluids, especially water. Staying hydrated is important for your body, and it will help you urinate every few hours. Fluids also help reduce constipation. Buildup of stool in the colon because of being constipated can put additional pressure on your bladder. Eating plenty of high-fiber foods will also help avoid constipation. Tobacco use is known to increase bladder issues. If you use tobacco, taking steps to quit will not only reduce your chances of having bladder issues, but will also benefit your overall health. You should reduce the amount of alcohol and caffeine you drink. Alcohol can make bladder problems worse, while caffeine can increase incontinence symptoms, such as a frequent or urgent need to urinate. Lastly, make sure you know your medications. Some medications make it more likely for your bladder to leak urine or dull the nerves in the bladder, reducing the urge to go to the bathroom. Did you know you can do exercises that will strengthen the pelvic floor muscle and increase control? These exercises are known as Kegels. Kegels build your pelvic floor muscles by tightening them. Doing a Kegel feels like holding your urine in when you need to urinate. To find the right muscles, the next time you urinate, start to go and then stop. When you feel the pelvic muscles tighten and move up, those are the right ones. To do a Kegel, you first need to empty your bladder, then sit or lie down. Tighten the pelvic floor muscles and slowly count to 3, then relax. You should repeat this 10 times and do this set 3 times during the day. Within a few weeks, you should start to notice a change. Here are a few things to remember as you start to do a Kegel routine. Do not do Kegels while urinating, and doing too many can cause straining when urinating or having a bowel movement. Also, for women, doing Kegels incorrectly may cause the muscles in the vagina to over-tighten. Remember, Kegels need to be a part of a routine just like any other exercise. If you stop, any benefit from doing Kegels will go away. Incontinence can be a difficult problem, but there are things you can do to help. If you're having any issues with urinary incontinence or bladder control, talk to your doctor. In this video, we've talked about treatment options that you can discuss with your doctor. We've also talked about lifestyle changes and gone over a bladder training exercise called a Kegel. Hopefully, these tips will help improve your quality of life, and you can keep doing all of the things you want to do without worrying about bladder control.